I really was grateful for a chance to talk about the Maternal and Child Health Services. I think we're quietly out there in the community, and to talk to other health professionals is a real privilege. So I put a photo up there. This little guy is actually my grandnephew, and I wanted to reflect how important it is to have children sitting up at a table eating healthy food. But I thought just a picture of him would give me a bit of courage, okay? Because this guy is not quite two in that photo. And in terms of chronic health and, the impacts of health on dental, he's a little guy who takes 20 medications a day, and a lot of them will impact his dental care. And so it impressed me greatly that at the Royal Children's they were very emphatic about teaching his parents, my nephew and his wife, about the care of his teeth through his illness episodes, which I won't discuss because I said to them I just wanted to use his photo. But the look on the face, and this is what our service aims for, is to have a little guy sitting in front of a plate of food looking as smug as you like. And for him particularly, because he was nasogastric fed for a long period, eating is just it was a real challenge for a period of time. So some of our children who have illness issues and are tube fed, that's a real issue for dental health, and it's an issue for their aversion to food and things like that. So that's one of the aspects that we do work and support families with. So so little Wei Wei is going to give me the courage to keep going today. So the context is really the interactions between oral health and general health throughout the phases of life have been covered very well here today, so there's no need for me to repeat them. But the early years are an excellent opportunity to encourage parents to assist children to understand the importance of dental and health and develop lifetime habits and practices to support their health through early intervention and support. And maternal and child health services are a key entry point for families because basically it's free, it's universal, we're located close to families and we're easily accessible. And we have been part of programs right along with dental health services, an example being Healthy Families, Healthy Smiles, and a few others that I'll talk about later. And I think maternal and child health nurses are very much team players. One of our great skills is being able to refer out to you people. So we assess and we see how, what's going on, and then we actually push people out to you. And I think that's one of the really important roles that we have in networking and connecting with people in our areas. And just to reflect back to John's slide about Coolaroo, it was my first centre. And just to reflect the relationships that I valued through my professional career is very early in the piece I realised I was way out of my depth as a new practitioner, and I thought, oh my God, I'm getting 30 people through the door every day. There's no appointment system, it's really overwhelming. And I went up and met my local GP on Barry Road in Coolaroo and had a sit down with him and said, I'm seeing this and this is happening and it's really full on, and how do I get people in to see you? And we developed a beautiful relationship of collaboration, which really came to fulfilment when I had a mother come in with an almost non-breathing baby one day. So I just took her down. When they saw me walk in the door, the doctor's, secretary realised it was urgent, and we got that baby on oxygen, and an ambulance called, and I had the support of a GP. So I think those collaborations and roles go way back, don't they? And so I think with the universal service, what happens is, and you may not be aware of it, and who here has used a maternal and child health service? So about a third of the room. And that's why I think it's important for you to understand what we do, because if you've never used us, you don't know we exist. And I get a lot of people at the front door of the first visit and they say, who are you? So I'll tell you. When a baby is born in Victoria, we receive a birth notice through council. And council has an obligation to make sure that we go out and visit that parent within the first 2 weeks. So the hospitals cover to day 5, and then we will get in there within that 2-week period if we know they're there. If the birth notice doesn't come through, it can be problematic, and that's where your role as health professionals, if you come across someone who's had a baby and it's recent, you just say, have you had a visit from your maternal and child health nurse? And if they say no, then ring the local council and inform them, because we will get out there. So in Richmond, there's 2 incredible nurses who work here, Sandy and Amy, and John's probably seen many come and go. And so I think what we then do is link the families, we meet them, and we invite them into our service. And our service stretches through to the age of 6. So we have, forgot I had slides. So we will see those children up until age 6, and further on I'll do show you our little caterpillar of care. But why children 0 to 3 and pregnant women, is where we focus. Dental admissions are the highest cause of preventable hospital admissions in children under the age of 5. I find that quite a shocking figure, and I did pinch that from the slide of someone in dental health, so if you're sitting there going, hey, that's my slide. But nearly 1/2 of 6-year-old children have a history of decayed baby teeth. Early childhood is a critical time when lifetime habits are established, and that dental decay influences everything for that child in terms of their oral health and in terms of their eating, and their how they feel about themselves can be really quite setting quite early if they've got really poor dental caries. Pregnant women are at increased risk of gum disease, and links between advanced gum disease and premature and low-weight babies is well evidenced. So we want to get women while they're pregnant going in to see their dentist, and fortunately we do see families at that time where they often will come in and tell us they're pregnant. We can refer them through to have a dental visit while they're pregnant. Poor oral health of mothers is definitely associated with early childhood caries in their children. And dental decay is Victoria's most prevalent health problem, as you've outlined previously. So today I wanted to just basically ensure that you're all fully aware of maternal and child health role and how we work with families and how we link with other health services. Explain, explore and encourage pathways for the support of families where children are identified at higher risk of health issues related to early dental problems, and identify the complexities for families in following through with the health advice offered, as it's a key barrier for them. We can say, yes, that you need to access these services and this is, but actually doing it is quite difficult. I've gone backwards. Hang on. And I guess just to frame how we work, Maternal and Child Health will celebrate its 100th anniversary this year. So we've been chugging along in Victoria since 1917. And basically we are a primary healthcare provider, and very much public health focus was the beginnings. So it's very much, the bread and butter of what we do is preventative healthcare, and I think that's why I love it so much, because hopefully we're getting in before things get too chronic. So what we have been involved in over the years is some, initially it was a lot of health and hygiene, immunisations, improving health. Probably one of the programs you're probably most aware of is the SIDS and Kids one, which I was a part of in the very early stage. I think it was 1992 or 93, we started to advise parents differently about safe sleep. And it's the most dramatic shift I've ever seen in anything. We had a rate of 1 in 500 babies would possibly have a SIDS in Victoria when we started, and nowadays it's something like 1 in 2,200, which really has been a very successful public health program. I mention it because it shows what can be done when we all get together and people with good research. inform us in our practice. And I think that's a really great example. Currently at the forefront of supporting families with modern crisis in mental health issues, family violence, gambling, increased poverty, social isolation and homelessness. Families coming from Aboriginal Torres Strait Islander families and called backgrounds. And I think, if you were someone who used the Maternal and Child Health Service 25 to 30 years ago, you'd find it's a very different service today than it was back then. And I think I still get referred to as the infant welfare nurse. I still hear people say, oh, well, you just weigh babies, that's what you do. And there's so much more complexity to our roles nowadays. Nurses traditionally were trained in hospital and then did a 4-month training course to do maternal and child health, but I think the last nurse who had those qualities has probably retired by now. Currently you require your Bachelor of Nursing, you have to be a midwife to do maternal and child health, and then you go on to do a postgraduate diploma in family, child and community health. Many of the nurses now are actually qualifying with masters, so they're highly qualified and highly trained. We do outreach, and to speak quite locally, City of Yarra receives 1,100 births every year, birth notifications. We've got 9 sites and 13 staff, and that's spread out around the municipality. And for each area you would find there's just nurses set out locally. We are trying to move to a model of co-location, and Richmond's a wonderful example of how successful that can be. And we also like all professionals to be aware that Maternal and Child Health Line is a 24-hour service line. So if you've got clients who come in for some other reason and report to you that they've got distress or concerns, but you're not sure what to do, they can always ring the Maternal and Child Health Line out of hours, because for families, 2 a.m. can be a great time. I actually can talk to someone, and those nurses will refer back to the local nurse. So it is a really beautiful circular network that we tell clients to ring them the out of hours line, and they will alert us that this woman's rung 4 times this week. She's not due to see you for another month, but could you get in? So that's very effective. And the enhanced maternal and child health services is what I do, and we work very closely with the centre nurses and receive referrals when a centre nurse has identified that she really feels this family needs more support, but she's not able to get out and do that. So whilst most families would get their key ages and stages and may not need anything else, other families will need a lot more intensive support. So usage by clients, the uptake of our service is excellent. 98% of people offered a home visit accepted, which we feel is incredible privilege to walk into someone's home the week after they've had a new baby and meet them and explain to them that we will follow up and that we're there to support them through the journey of being parents. So our friendly little caterpillar, you will see this logo in lots of places. And the first home visit, just to give you an example, at that visit we're assessing a number of things for the family, and we're meeting them and greeting them and trying to understand in a very holistic way what this means for them as a family to bring this new baby home, and who is this family, what environment is this baby in, and what impact is it having on the family. And so we see that as it's usually a 45-minute to an hour visit. So that, I know a lot of you will go, oh my gosh, that's such a lot of time. I really don't know how GPs do it with 10 minutes with a client. I think you're extraordinary. But within that time, we are gleaning so much information. And we also have to kind of work through understanding the whole picture. So questions that we ask are extensive, and we're asking about the mother's health, we're asking about their siblings, we're asking about the entire family and their history. the emotional holding within the family, so who's there to support you. So, I think from your perspective, if you've got a client in your office and you really want more information and they're happy for you to talk to us, sometimes we can work really well together because we can inform, with the client's permission, we can inform you about what's happening on the background, which they wouldn't have had time to discuss with you. So it's often really helpful. We see them again at 2 weeks, 4 weeks, 8 weeks. Obviously, the dental aspect of we get lots of questions about mouths and teeth. And I had to laugh when Wong was saying, people love opening their mouths for me. We find the same, that parents love us to look in their babies' mouths. Even at the very first home visit, I've had parents say, but my baby's got a tooth. And probably you dentists have all seen this, that little remnant there that shouldn't be there. So, we do look in babies' mouths every visit. We do a full physical assessment every visit. We do top to tail assessments. And part of that is lift the lip. We lift the lip on all the children, and we ask the parents, if there's teeth there, how are they going? Specifically targeted visits at the 8-month consult, we've got the beautiful tooth tips 0 to 12 months, which I was going to put a graphic on this, but I meant to apologise at the start. I'm just not great I've never used PowerPoint before. So with the tooth tips, what we do is, it's a lovely new graphic that we've got. Thank you, whoever developed that, if you're in the room. And it's got the picture that we all know of the dental caries, and we show that to the parents, and we explain about the importance of dental care and teeth cleaning. 12 months and 18 months we do the same, and we refer families for a dental check for their child. We say at 12 months it's something you should consider, and many will go at that point. If they haven't been, we say it again at 18 months and at 2. So it is a huge part of what we're doing. Some of the other services that we refer to and that you might find helpful, they're all agencies that you probably are aware of, but and some of the things that are developing in maternal and child health is that we're very excited because we're getting a new flip chart. So I was at Moreland Council, we had that beautiful big one that we were part of a pilot, so we got them. But we're very excited about our new flip charts because it's a great tool to sit with families and actually go through. We've got the old ones, but these will be more compact. And Maternal and Child Health Services have been a part of a number of programs that have... now, I won't... Lisa will probably talk a bit about some of the projects she's been doing, but just to collaborate with dental services when they come out and ask us, can we research? Maternal and Child Health are one of the greatest supporters of research. We're often involved in lots of dental research programs. So this is some of the pathways from us to different services. This is a graphic that's specifically around Richmond. We've got programs for Zumba classes for African women. Here we would send the mums and say, look, go get a jiggle and, bring your baby, and it's really great for them. Rhyme times, learning English with childcare provided is available around here. We've got Melbourne Museum in the area, which is great. What to do when your kids have a tantrum, and tuning into kids as a parenting support program. And I didn't have the graphic of Circle of Security, but Circle of Security group just started for the first time this year. We've got one session off the ground, and it was very well attended down in Collingwood. So the parenting support that gives. These are the pathways for referral. I know you all know them. And issues facing families. This was, how much longer have I got?
You're done.
Okay. Just one last word. I think one of the things I wanted to highlight is that when you see a child with dental caries, there's a whole story behind it. And John spoke so beautifully about the vulnerability of families where there's drug and alcohol usage, or if there's a refugee family. Particularly family violence, I find those women really, really struggle to get their kids to anything because they're really at ground level, they're just trying to keep themselves and the kids safe, and accessing some of these services is impossible. I work a lot on that. I've got a lot of families in my service where that's been the issue, and their mum's on their own. They're really trying their very best, but it's very difficult for them. And co-sleeping and just getting the babies to sleep with the bottle is part of that trauma and crisis. So if you're seeing that issue, it's going to be very difficult to unpack, and they really need in-home support. So I don't want to drum up referrals today because we are constantly busy, but I think it is something to think about, to refer your clients back to Maternal and Child Health, see if we can get linked with parenting support, because it is a parenting problem. It's a major parenting issue for those families. And if you don't know how to refer to me, then it's really quite simple. You send them through to the Maternal and Child Health nurse. And Ruth and I are just going to stand here for another minute. You send them through to the Maternal and Child Health nurse, and she'll refer into me. So I think just knowing your local Maternal and Child Health nurse would be great. All right?
Yeah.